They were told they were being treated, told they were receiving free medical care, told the government was there to help. But for 40 years, the treatment never came. This is the story of the Tuskegee syphilis study, a government experiment that used black men as test subjects and left them to suffer in silence. Atmospheric bridge with ambient sounds of wind. In 1932, in Tuskegee, the U.S. Public Health Service began a study. Its purpose? To observe the natural progression of untreated syphilis in black men. 600 men were recruited, 399 with syphilis, 201 without. Most were poor sharecroppers, many could not read. They were told they were being treated for bad blood, a vague term used in the rural South for various ailments. They were promised free exams, free meals, burial insurance. They were never told the truth. From the beginning, the study was not about healing. It was about observation. Even after penicillin became the recognized cure for syphilis in the 1940s, the treatment was deliberately withheld. Doctors tracked the disease as it damaged bodies, blindness, mental deterioration, organ failure, death. The men were not informed of alternatives. They were prevented from accessing treatment elsewhere. Draft boards were notified to ensure infected men were not treated through the military. The government did not simply fail them. It intervened to keep them sick. Ticking clock bridge. The study was rooted in racist pseudoscience, the belief that syphilis affected black bodies differently than white ones. Researchers claimed they were gathering valuable data, but similar studies conducted on white patients had already ended once penicillin proved effective. This one continued for 40 years, from 1932 until 1972, 4 decades of sanctioned neglect. In 1972, a whistleblower named Peter Buxton leaked the story to the press. The nation reacted with shock, but for the men in Tuskegee, the damage had already been done. By the time the study ended, at least 128 men had died directly from syphilis or related complications. Dozens of wives were infected. At least 19 children were born with congenital syphilis. The experiment had expanded beyond its original subjects, into families, into generations. In 1997, 25 years after the study was exposed, President Bill Clinton formally apologized on behalf of the United States government. He called it what it was, a shameful chapter in American history. But apologies do not restore sight. They do not reverse neurological damage. They do not bring back fathers. Trust, once broken, is not easily repaired. The Tuskegee study did more than harm 600 men. It reshaped the relationship between Black America and the medical system. The Tuskegee study forces a difficult question. What happens when the institutions meant to protect citizens decide some lives are expendable? History is not just dates and documents. It is decisions. And in Tuskegee, the decision was clear. Observe, withhold, let them suffer. This is not just a story about the past. It is a receipt. And it reminds us, medical ethics in America were not freely given. They were demanded. Uncovering the receipts from the past, our teacups are never empty. Subscribe, like, and comment for more stories they forgot to teach. Aloha.